I've been asked to talk today because I'm local. I'm the local paramedic, and I'm friends with the organisers, Sarah, Pete, Viv, and they asked me to just come for half an hour and have a chat. I'm happy to answer questions that anyone might have about my perspective on the pandemic and things that have been happening, but I didn't want to come out here and just tell you all what you already know. I thought I'd do something practical. I'm sort of a person that thinks, well, things are the way they are, but what are we going to do about it? And I thought, well, what do I know? I know CPR, and I thought with all the sudden cardiac deaths that we've been getting and heart issues and the myriad of other things that have been increasing since around mid-21, thanks to some stats we got through Alex Antic, the Freedom of Information stuff that you may or may not have seen. If I can show you some things about CPR today and how to behave and some practical steps to take when a loved one or someone you know or someone from the community collapses and goes into cardiac arrest, then you might actually save a life. And there's a bit of a misconception that us guys are the heroes and we come in and save lives, and particularly with cardiac arrest, it's actually you guys, it's the bystanders that really save the lives, because if someone goes down, their heart's not beating. If someone doesn't start beating that heart for them very quickly, then we're usually not there quick enough to make a meaningful difference. So it's everyday people that can jump on a chest, keep a heart beating until we arrive, take over and do some of the fancier stuff, get them to hospital, and hopefully there's a good story out of it. But so showing you some things today, hopefully you never have to use it. And if there's anyone here that's experienced anything like this and you know it's upsetting, feel free to just wander off and go and feed the ducks or something. But yeah, so any questions to start with? No? All right.
What do you think about, I watched Barbara O'Neill one time and she said about it's hard to tell whether it's actually her or someone doing a voiceover, but cane pepper to stop a heart attack, which I've heard that like...
Oh look, if your coronary arteries close up and your heart's not getting any blood flow, good luck trying to throw down some cayenne pepper to do that. That's sort of something that's a lifestyle change that I would imagine that you'd need to instill in yourself, like do. There's a whole myriad of stuff people can talk about to avoid a cardiac arrest. In a cardiac arrest, you've probably got 1 to 2 minutes before you start to die in the brain, and that's max. After that, you're going to start losing brain cells, and there gets a point that even if us guys can get the heart going, what's the point? You know, a lot of people will get the heart going, get them to hospital, and unfortunately they've suffered brain damage to the point that their quality of life's severely diminished, or there's only one sort of answer. So look, as far as medicine goes, we all know that there's a lot that's not right. One thing this is my perspective, one thing that I think that Western medicine does really well, and that's acute stuff. If you hit a tree and you need to go to a major trauma centre, or you have a stroke, now the causes of the stroke, we can talk all day about that, but when it happens and your life is going right now, heart attack, stuff like that, it actually does reasonably well. Recovery, long-term stuff, that's a whole other conversation, right? But the sudden acute stuff, they actually do a pretty good job. Unfortunately, some of the long-term lifestyle stuff has got a bit out of control, and as we all know, there's lots of money involved. But I didn't want to talk too much about that today. It's just here as an education sort of talk. I haven't done this before, so it's going to be a bit rough, but I wanted to talk about cardiac arrest and when someone drops or goes into cardiac arrest, or you find someone that's unresponsive. So one of the most important things is early recognition. Like, how do you tell if someone's having a heart or in cardiac arrest, or they're just having a snooze, right? Probably the first thing to do is see if they're responding, okay? So give them a shake, give them a slap. Probably don't give them a slap, you might end up getting in trouble, but give them a good shake, yell at them. You know, it's surprisingly easy if you're concerned, particularly if you know the person and they're not right. You just know instinctively, oh, something's not right. Wake up, you know, or usually a lot of the times somebody will drop in a public place, you know. So if they're not responding and they're not breathing normally, and I say not breathing normally because sometimes they might not be breathing, or they might actually be breathing but not normally. There's a thing called agonal breathing. So they'll be breathing but it'll be weird and it'll generally be slow. So if they're not responding and they're not breathing normally and you can't get them to wake up or whatever, they're probably in cardiac arrest. Now I won't tell you to check for pulses and things like that. If you've done that and you're used to that and you've done first aid and you've felt for a pulse before, feel free. But even us guys sometimes have trouble feeling for a good pulse. So if they're not responding and they're not breathing normal, jump on the chest, okay? When I say jump on the chest, probably before that actually, it's called 000. Because you could be starting CPR and then realise, oh shit, I'm on my own. Who's coming to help me? So call for help, all right? Even before you jump on the chest, call 000, I need an ambulance. Put it on speaker, put it next to you where you can talk, jump on the chest, okay? Sometimes people don't have cardiac arrests in convenient places, unfortunately. They normally don't just sort of lie down in a nice open space and, no. They're on a couch, on a bed, on a toilet, in a car, and trying to do CPR in those situations is next to impossible. So if you're able to, move them to a spot that's close, plenty of room, and flat and hard, okay? If you can't do that, and there's a saying, something is better than nothing. So I've been to some jobs where people have unfortunately passed away in the front seat of the car, big, the person that's helping them small, can't get them out, it's very awkward. Do something is better than nothing, all right? But if you can, move them to a space where you can work, okay? Call for help, get on the chest. The reasons we do this is, like I've said, survival from cardiac arrest is actually pretty good if they get good quality CPR, we get there quickly and they get into a hospital where they can unblock that coronary artery. How do you perform CPR? Well, this is what I'm going to show you now. So, come round. What you want to do is you want to get down on your knees, centre of your chest, one hand in the middle, one hand over the top, lean up, lock your elbows up, lean up over the top, and use your body weight to push, okay? Now, you'll be surprised how tiring it is, and you could be waiting a while. And even when we get there, we may want you to keep going because we're setting up for airway, we're getting other stuff done. There might only be two of us, there might only be one of us. It really depends on the availability. We're very busy people, which we won't go into why. But, you know, so the whole point of locking the elbows out and getting your body weight over is you're actually going to bend at the hip and use your body weight to do a lot of the work. Instead of, if you've got your elbows bent like this and you're pushing like this, you'll tire out very quickly. Gold standard CPR is we change every 2 minutes, okay? Later on, we'll probably just do it every 1 minute. But if you've got a few of yous around, approximately every 2 minutes, even if you sort of stronger, younger people are doing it and they're going, nah, I'm all right, I'll keep going. Studies have actually been done to show that even though you think you're doing good CPR, after about 2 minutes, the quality drops. So the trick is to start doing CPR, lock your arms out, body weight over the centre, and just Bend at the hips and use your body weight to push up and down. You don't have to think a lot when you're doing this. They're actually one of my favourite things because you don't engage this a lot, and it's just a task-focused thing. So while you're doing this, you could be yelling out to someone, hey, can you come and over the other side here? What I want you to do is take over for me in a couple of minutes, okay? I'll give you a shout when you're ready. Because the reason you want to communicate with other people around you and get them all set up is if I'm doing this and I'm going, hey mate, come over here, give us a hand. You've only got to be off that chest just for a few seconds and the pressures start dropping. The pressure to the brain starts dropping, and it's going to take you another couple of minutes to build that pressure back up again. And those 2 minutes are while that brain isn't getting any blood and any oxygen, so they're losing brain cells again. So CPR and early defibrillation is one of the most important things, okay? Outside of all the fancy drugs we do and the tubes and all the other stuff, that's this early CPR and early defibrillation are what really saves lives, okay? So get on the chest, bend at the hips, arms straight, get your mate over on the other side, and then when you're about 2 minutes, you may not be timing it. Someone, you know, you may not be able to know exactly where 2 minutes is, but get ready to switch out. If you're really starting to struggle to get through the 2 minutes, you can get them to switch out a bit sooner. Yeah, all the while you're going to have 000 on the phone, hopefully, if you remembered to call them before you jumped on the chest, and they're going to be talking you through it. So you're going to be getting coaching as well, okay? And you're going to be told how far away we might be, okay? So yeah, they're 5 minutes, they're around the corner, they're just coming in through the front door, all right? And when we walk in, we'll usually say keep going, okay? Until we set up and get all our gear ready. All right, so the other thing, I mentioned is these things here. So if you want to just come a little bit closer, I'll actually bring it over. This is a automatic external defibrillator, and this one's just a training one, so they don't all look like this. They're everywhere now, okay? RSLs, malls, sporting clubs, yeah, they're everywhere. So again, while you're on that chest, you could be telling people, is there a defib around anywhere? Really easy to use. It's almost impossible to hurt someone with it. It can tell whether the heart's beating or not. So what we try and encourage is just have a go. Like we said, something is better than nothing. So pull it apart, follow the instructions, put it on, push the button, just have a crack. Chances are it's going to work and you could save a life, all right?
With the pads,
Yep.
there's two, isn't there? So
Yes, there is.
goes on this side,
Yep.
and one on this.
Yep.
This is delicate. What if someone's got a big boobs?
Well, yeah, that's a good question because, and the other thing is too, some people don't just drop. They'll start off going, oh, I don't feel right. Oh, geez, I've got to sit down. I'm feeling dizzy. Oh, I feel sick. And they'll go pale white and they'll sweat profusely. And so they're all wet and hairy if you're a bloke like me, and so, or big boobs. Do your best, okay? Dry them down. If they're really sweaty, just quickly wipe, because you're gonna have to bare their chest anyway. So give it a quick wipe with their clothes.
So where do you put the...
So it says it on there, it's actually got a picture. It'll have a picture on it, and it'll tell you, well, this one goes about there. Okay, now it doesn't need to be exact, but you pretty much know it goes up on the upper right chest there. And the other one, if you can see that, it goes under the left breast around the side. If it's the boobs are hanging down, you lift the boob up and you go smack. Yep. I'm pretty sure the dead person isn't too going to be worried about you touching their boobs. All right? So
you said, you mentioned, last time I did a first aid thing was a long time ago.
Yep.
You didn't mention anything about breaths.
no, and thanks for reminding me. Like I said, I haven't done this talk before, so I'm a bit rusty because I normally it's all muscle memory, but we don't worry so much about breaths anymore because by getting people to do breaths, I mean, there's the whole where have they been sort of thing, and they could vomit and all that sort of stuff. And it's time off chest. You know, there is a conversation to be had about breaths when you're talking about younger people who might be hypoxic. So if you've pulled a kid out of a pool, for example, their primary reason they're probably in cardiac arrest isn't that they've had too many bacon burgers over the years. It's usually because they can't breathe. And so then breaths are definitely more important. I wanted to keep this simple, okay? So if you think that their primary cause of the cardiac arrest is they can't breathe, then breathing's important. But 90% of the time it's going to be that their coronary arteries have closed over or something's gone untowards with their heart. And then we're focusing on pumping that heart. Because if it's sudden, a lot of the times there's still enough oxygen in their blood anyway. And by pushing on the chest, you're actually pushing on the lungs. So there's a small amount of air that's coming in and out. And we just want you to stay on that chest. That's the most important thing. And getting people to breathe and stuff, they're stopping CPR. Yeah.
Makes it easier.
Yeah. And that's the important thing. Even if there's a negative outcome, and I can speak from personal experience, if you've done the best you can for the survivors, that's so important for your mental health and how you feel about everything, particularly if it's a loved one. If you don't know to do this stuff and a loved one drops in front of you and you freak out and you're on the phone and you're crying and you're hysterical, that's so hard to deal with compared to, right, I've got this plan and I'm helping this person now. And I know that if whatever the outcome, us guys, if we can do our job well, it's so much better for our mental health. So this is about helping you as well as the patient. All right, so any questions so far? Thanks for that, because I'd forgotten about that.
Yeah, Shane. Yep. If it's an old person, are you worried about breaking their ribs doing that?
Well, it's about risk versus benefit. We all know that terms, don't we? What's the risk versus the benefit? Their heart's not beating. Why are we concerned about broken ribs when they're dead? Okay, so yes, older people, you can break their ribs, you can do some terrible damage. And then you've got to have that, if it's a loved one, you've got to have that, hopefully you've had that conversation about their wishes. You know, you get to a certain age where nature takes its course and really, if they've lived a very long time and they're very unwell and that their hearts stop beating, jumping up and down and breaking ribs and getting us to cut their clothes off and stick holes in them might not be what they want, and it may not make a lot of difference to the outcome. So yeah, there's sort of things that are good to think about beforehand. In the heat of the moment, it's really hard. And that's why, you know, if you've got any loved ones or even yourself, if you want to have this conversation with your family, it's really important, because one of the first things, particularly with the elderly or the people that are terminally ill or near that way, one of the first questions we'll ask are, what are their wishes? What do you guys want? What did they want? Okay. So have a think about that, have that conversation with your family. Nobody likes to talk about it, but it's a part of life. Unfortunately, we're all going to end up in the same place. So it's good to have those conversations beforehand. And if you think there is a good outcome and they do want something done, or you don't know them and you're just like, I'm just going to help, and their heart stopped beating, broken ribs are the least of their problems. And it can be quite confronting when you're pushing up and down on someone's chest and you can hear it breaking and stuff. It's tough. So the other thing is,
reassess and keep going.
yeah, and afterwards when the dust settles, seek help, talk to people, talk to us, talk to people you trust, because it can be tough on your mental health as well. Okay.
Another thing, if someone collapses and
Yep.
you don't know what the cause is, if it's just,
Yeah.
you think if it's say a stroke,
Yep.
you think it's a heart attack,
Yep.
you're doing heart massage,
Yep.
are you doing damage?
Again, we're assessing whether they're responding and they're breathing. Now, strokes, generally, they might not be responding, or they'll be partially responding, but they'll generally be breathing. All right, if someone's stopped breathing or they're really not breathing effectively and they're making weird sounds and it doesn't look like it's working, it's probably the heart. And again, the chance, because the percentages are that it is the heart. You don't want to overthink it and you want to help, okay? Even the professionals struggle sometimes with why something's happened or what it is. We just follow our process, get them to where they need to be, and that gets worked out down the track. So, all right, now I was only asked to talk for half an hour, so we might move on. Who's keen to try some CPR? Yeah? All right, so I've got 6 mannequins. What we want is one either side. Okay, so come on up. I've got a lovely assistant over here. And just some random person in, I don't know him at all. So does anybody want to try? Yeah, come on up. There's, hey? We're up to half an hour, all right. All right, lock the hands out on the chest.
So what you want to do also, so my name's John, I'm a paramedic, also work with Shane. The amount of beats you want to do is 100 a minute. So you're either a queen fan or who's the other one? Another one bites the dust. Yeah. So it's 100 beats a minute. So you want to go on, lock those arms out, like 1, 2, like another one bites the dust. Or staying alive. So slightly faster is better than slightly slower.
No, just push on the chest. So that beat. So just sing it out to yourself if you ever have to do it. Maybe not loud, because bystanders might think, who's this sick guy, like, staying alive, you know, so that's it. You want third of the chest and allow recoil, so bounce up, push down up. So you come off the chest a little bit more. Yep, that's it. Because the thing is, you want to push down, but you want to allow recoil, so that heart pumps. That's it. Who's getting tired? All right. You ready?
Yeah.
Change.
Ready. That was quick.
Who wants to change out? Change? Change.
Come to life.
Change. All right. You ready? Yep. Change.
Let's get you going, though.
It does, doesn't it? Thanks, guys.